Mr. Sanders, do you hear me?
I can hear you, yes.
You hear me and you can't see me, right? We have some technical issues.
I will start my video.
Yeah, we know, but there is some technical issue about my video. So if you want to, do you hear me?
I can hear you, yes.
Okay, if you want to, I'm going to announce you, then we will start in this way for now, okay? Okay. Yep. Tekrar merhaba efendim.
You will mute me.
Görüntümle ilgili bir problem oldu ama...
Hello again. I have run into a problem about my camera. Our speaker has no problem. He's going to present with his camera on, and I'd like to start with a reminder. There is English and Turkish interpretation. If you would like to listen, interpretation, you can click on the channel.
There is a button at the bottom of the screen. For English, please click on English. For Turkish, please click on Korean button. And now I would like to introduce the first speakers of our Congress, bringing you together with the leading names in their fields. Our first keynote speaker is Professor John B. Sanders from Australia, who is currently working at the University of Queensland, the National Centre for Youth Substance Use Research. Professor Sanders is here to deliver his presentation, as you may know, titled Gaming Disorder, Meeting the Challenges in the Pandemic Era. Mr. Sanders, welcome again. It's a privilege, a big honor to see you, sir.
Thank you very much for that introduction, and good morning to you all.
Oh, thank you. Now I leave the floor to you, sir.
Thank you. Well, here I am in Sydney, Australia, actually giving this presentation from my consulting room, where I've been seeing patients during the day. I am delighted to give this keynote speech at the 5th International Technology Addiction Conference. In 2017, I greatly enjoyed participating in that year's conference in Istanbul. Now, with the COVID-19 pandemic, it has to be an online conference, but I hope it will still be helpful for your work, and I congratulate the organizers of the conference and the Turkish Green Crescent Society as a whole for their efforts and their success in convening this conference. This slide is a declaration of interests. In my clinical practice, I treat people with gaming disorder as well as other addictive disorders, and I engage in research in this area. I've been an advisor to the World Health Organization for the last 40 years. In that capacity, I've been closely involved in developing the definitions and diagnostic guidelines for substance use and addictive disorders, and this includes gaming disorder. I've also been involved in a series of WHO reviews as part of an advisory group on the diagnosis, treatment and prevention of gaming disorders, as well as other addictive disorders. With regard to this particular presentation, I have no other conflicts of interest to declare. In my talk, I shall cover the following topics. I shall be talking about some of the most popular online games. I shall be talking about the impact of the COVID-19 pandemic, and including its impact on mental health and gaming and gaming disorder. I shall be talking about the responses to the pandemic. I shall be introducing you or reminding you of the concept of hazardous or risky gaming and the ICD-11 diagnosis of gaming disorder. I shall then move on to the prevention of hazardous gaming and gaming disorder, treatment of these conditions and service delivery, and end up with some conclusions. We are confronted at the present time by two major challenges. First of all, the digital revolution, and secondly, the COVID-19 pandemic, and how these are coalescing to present the issues and challenges that we face presently. Now, the digital revolution, of course, has brought huge advantages. Literally unparalleled connectivity through the internet to a wide array of information important for schoolwork, college and university work, and work in the general workforce. Unparalleled availability of news, updates, social networking, and of course, the topic of this conference, to games, online games. This revolution in technology has resulted in increasingly sophisticated online games. And although, as a health professional, I have concerns about the negative impact of online games, I must say that these games are very well developed. They are enjoyable, interesting, innovative, engaging, but they are also addictive. And the degree to which they are engaging also correlates highly to the degree to which they are addictive. This slide lists some of the main types or genres of online games. And I've highlighted in colour some of the most popular games, specifically the 3 most popular online games, at least outside China. For example, one of the Battle Royale games, Fortnite, has 400 to 500 million registered users. Apex Legends has a similar number of registered users. And at any one time, more than 50 million people are playing Fortnite or Apex Legends. And some of the others, notably Minecraft, are also extremely popular. And so these have become global phenomena. Now let me summarize the COVID-19 pandemic and its impact generally first and then on gaming. This pandemic began in late 2019, and it has been the largest, most rapidly spreading and severe pandemic since the influenza pandemic of 1918 to 1919, before the creation of the modern Republic of Turkey. As of the 22nd of May 2021, which is when I prepared this presentation, there were 167 million reported cases worldwide, and at that time, 3.5 million reported deaths from the COVID-19 illness. These figures are widely considered to be underestimates. There are perhaps 500 million cases which have occurred, and it's estimated that there have been more than 10 million deaths due to COVID-19 worldwide. In the early months of the pandemic, there was a 40% reduction in economic activity and share market capitalization in many countries. That figure relates, amongst other countries, to my own country of Australia, when there was a near 40% reduction in the share market. It's been estimated that some countries will suffer an approximately 10% long-term economic loss. One of the difficulties have been, of course, lockdowns, enforced lockdowns, necessarily as a protective strategy against the widespread transmission of the COVID-19 virus. This slide lists some of the government responses, particularly those at a population level. You will have seen from the news, so many countries have closed their borders to people outside that particular country. There's been large-scale cessation of international travel, cessation of internal travel in many countries, and governments in also many countries have imposed lockdowns with essentially stay-at-home laws which prohibit people leaving their home except for essential purposes such as the purchase of food or medical treatment. There's been widespread closure of public facilities, including many shops, closure of schools and higher education institutions, closure in Australia of most hospital clinics, except those providing acute and emergency care, closure of sporting facilities and of clubs, bars and restaurants. There has also been recommended or imposed social or spatial distancing, so that there needs to be a distance of 1.5 or 2 meters from another person. Governments have encouraged, and in many cases mandated, wearing face masks in public and using disposable gloves, using hand sanitizer and frequent hand washing, avoiding touching your face, and a very welcome development from December 2020, vaccination against the COVID-19 virus, with 4 vaccines being widely and internationally approved. This, we hope, is a turning point in our fight against the virus, but we should recognize that the COVID-19 virus has proven its ability to mutate, and indeed the so-called Indian or Delta variant is much more infectious than the previous original coronavirus variant or other variants. And so some of these measures will need to be in place for a considerable time in the future, hopefully reducing with the mass availability and uptake of vaccination. And I would highlight the progress of the government and the people of Turkey in the rollout of the vaccination program in your country. Now, these necessary measures have, of course, had widespread mental and social impacts. That has included social isolation, affecting all demographic groups, but particularly the elderly, who've been robbed of contact with their children and grandchildren, but also young people have become socially isolated. There are significant challenges of looking after children and other family members in very confined situations. I attempted to homeschool 2 of my grandchildren, and that was an extremely difficult experience for all parties. Importantly, the COVID pandemic and the associated lockdown have had significant adverse impacts on mental health, being development of anxiety or worsening of existing anxiety. Although social anxiety has sometimes been alleviated. With regard to depression, many new cases of depression have developed or existing cases worsened. Likewise, with post-traumatic stress disorder, newly developed illnesses or worsening of existing PTSD symptoms has occurred. You will be aware, of course, of the syndrome of prolonged COVID illness, or so-called long COVID, and a range of mental health disorders which have developed as a direct consequence of this particular prolonged syndrome. And these impacts continue to a varying degree in different parts of the world. Many of the restrictions have been lifted in Australia because it had initial considerable success in containing the COVID infection. But there are many countries which are experiencing a new wave of COVID infection and illness who are imposing or reimposing the protective measures and are experiencing the impacts that you see in this particular slide. Let's have a look at the impact of the COVID-19 pandemic on gaming. You will probably be aware that in the early months of the pandemic, there was vigorous lobbying by the gaming industry and the promotion of the phrase play apart together. So play games, online games, in your own different locations, for example, at your own different homes, which was a way of promoting online gaming as a socially responsible activity. And to an extent, this is correct. However, what happened was that there was a huge surge in online gaming, and we have some useful information from gaming industry sources, and I give a reference in colour at the bottom of the slide. The gaming industry noted an unprecedented surge in consumer demand. In the United States, the gaming audience grew over 4 months to 28 million people, as from March to July 2020, with a 28% jump in gaming using mobile devices specifically. In the United Kingdom, there was a 50% increase in mobile gaming. In South Korea, there was a 34% jump in mobile gaming. And in Germany, there was a 25% increase in mobile gaming. This set of analyses, which, as I say, comes from gaming industry sources, commented that the increase in online gaming does not appear to be temporary. And more than half of the respondents involved in these surveys said that they plan to continue mobile gaming. Now, that may be unremarkable. It may provide people with enjoyment due to being involved in the game. But whenever there is an increase in the involvement with an addictive activity, such as online gaming, there is likely to be an increase in the number of people with hazardous gaming and gaming disorder, which is the addiction. So, in summary, the adverse impact of the COVID-19 pandemic and necessarily restrictions and lockdowns on people's activities, on mental health, and the difficult and constrained environment and the limitations on normal recreational and social activities act as an almost perfect combination to promote unhealthy gaming and the development of gaming disorder. We therefore have substantial challenges to ensure that what might otherwise be a pleasant diversion from the impact of the pandemic does not escalate to an epidemic of gaming disorder. And this is a challenge which faces all of us working in the health and social professions. Now, what are some of the broader responses to the COVID pandemic and its impact on gaming. Well, I've identified some of them in this slide. It's important to know when and how online gaming moves from being a pleasant occupation, a pleasant diversion, to become risky or hazardous. It's important that we're able to identify those with gaming disorder, including those in the early stages of this addiction. It's important that we provide advice and help for families to prevent gaming disorder. And we certainly need a more adequate array of interventions, including some medication treatments for gaming disorder. For COVID-19, in parallel, we need, as human beings, to accept the need for precautionary and preventive behaviours. We need to be prepared to wear face masks when this is required by governments or the health authorities. We need to observe, as appropriate, spatial distancing and hand washing and other preventive measures. We need to ensure that we live in safer environments which reduce the potential spread of the COVID-19 virus. And indeed, I would just have to make a comment that we have to be very careful about certain environments like nightclubs. If ever there was a more perfect environment for the COVID virus to transmit widely from person to person, it is a typical nightclub. And we have to be very thoughtful as to how we provide protective measures in these environments. And as I've said, we need to be ingenious, we need to be systematic in the development of vaccines and the rollout of vaccines into the wider community. We also need to be clever in developing new treatments for those who have developed a COVID-19 illness. And of course, it is encouraging to see the developments and treatment which have occurred over the last 12 months. There is no magical treatment for COVID-19, but there are our ability to treat the COVID-19 illness is much, much better than it was at the beginning of last year. Now, I want to move on now to ask the question, when does gaming become risky? Because in many countries, the majority of adults, and certainly the great majority of young people, engage in online gaming. So when do we know gaming has become risky? Well, this slide shows you the definition by the World Health Organization of hazardous gaming, risky or hazardous gaming. Please note, this is not gaming disorder. This is not yet an addiction, but it is a term which is given to people whose pattern of gaming increases the risk of harmful or physical or mental health consequences or the development of the gaming addiction. Now, this appears in the new revision of the International Classification of Diseases, ICD-11. Hazardous or risky gaming is defined as a pattern of gaming that appreciably increases the risk of harmful physical or mental health consequences. And this risk may come from the frequency of gaming, the amount of time spent on gaming each day, neglect of other activities, and the pattern of gaming often persists in spite of that person being aware that there is a risk of harm. Now, a simple question is, how many hours a day does it take for gaming to become risky or hazardous? And we have to say that the threshold of the number of hours per day spent gaming, or the frequency of gaming in terms of the frequency per day or the frequency per week, for the risk of the development of gaming disorder or physical or mental harms is not clear at present. But we have some clues from recent scientific publications. I quote from a paper published by Andre and colleagues last year, 2020. And they say, when comparing the probability of problematic or addicted gaming with non-harmful gaming in statistical analysis, spending more than 4 hours per day increased the probability of more adverse gaming impacts significantly. So they set it at 4 hours per day. And then a series of studies published in the 2 years prior to this said that there is evidence that the number of hours spent on broadly social media, predominantly online gaming, increases the risk of gaming that is pathological. And several researchers suggest a cutoff of around 3 to 4 hours per day. Now, there are a number of other risk factors beyond time spent per day for developing gaming disorder and gaming-related mental and physical harm. Many people do spend a lot of time gaming, more than 4 hours a day, and yet still discharge their responsibilities to family, for their education and work. There are many young people who are seeking a career in as professional gamers, just as they might seek a career as a professional footballer or a sports person in other sports. So we do need to be aware of that general threshold of 3 to 4 hours per day gaming. But there are individual risk factors beyond that, which can identify people at particular risk of developing gaming addiction and associated problems. And these include low academic performance compared with peers or brothers or sisters, social anxiety disorder, certain forms of depression. Importantly, and unique for addictive disorders, autistic spectrum disorder, including Asperger's, ADHD, together with family factors, including instability in the parental relationship and overly high expectations by parents of success. Now, this diagram, which I call the pyramid, shows you where hazardous gaming fits in the spectrum of involvement with online gaming. And I don't know if you can see my cursor, but at the base of the pyramid are people more middle-aged and older people than young people who do not engage in online games at all. Then there are the majority of the population, including the majority at present of young people, whose involvement with online gaming is below the currently accepted thresholds for harm. Then there is what I have been talking about so far, hazardous gaming, when typically gaming exceeds 3 to 4 hours per day, and when the person is gaming in a way that poses risks, particularly including those young people who have the risk factors that I identified in the previous slide. And then at the top of the pyramid, there is gaming disorder, which I shall define shortly, and that is the addiction. Now, here you will note that there is an entity called harmful gaming. This does not yet feature in the International Classification of Diseases released by WHO, but I suspect it will be described in an early revision. And so harmful gaming would be a pattern of gaming which has resulted in some mental or physical harm, but has not yet developed into an addiction. Now, what is the addiction? How do we define gaming disorder? Because this is the focus of treatment and also our preventive efforts. So gaming disorder is characterized in ICD-11 by a pattern of persistent or recurrent gaming, particularly online gaming. It is manifest by 3 central features and a requirement for impairment. Those central features are, first of all, impaired control over the activity of gaming. So impaired or poor control on the onset of gaming, its duration, the inability or decreased ability to terminate online gaming at an appropriate time, or online gaming in a inappropriate context when the person should be attending to other life responsibilities, including their education. So that's one criterion. The second is increasing priority given to gaming over other activities, over other life interests and other responsibilities, so that gaming takes increasingly center stage in that person's life, and other responsibilities such as study or work, social activities, personal relationships are pushed to one side. The third guideline or criterion is continuation or escalation of gaming despite the occurrence of negative consequences. And importantly, the pattern of gaming is of sufficient severity that it results in significant impairment in one or more of those areas of functioning that you see in the slide. And I do want to emphasize that we require significant impairment in functioning for the diagnosis of gaming disorder or gaming addiction to be legitimate. Typically, the pattern of gaming behavior should be present over 12 months or more, but a shorter period, such as 6 months, will lead to the diagnosis if all the diagnostic requirements are met, and particularly if the symptoms are severe. The validity of this definition of gaming disorder in ICD-11 was attested to by an international group of experts, both clinicians and researchers, who indicated the validity, the value or utility, and the prognostic value of these 4 central features: impaired control, priority in life, continued use despite harm, and functional impairment. And you will see that this international group, in the study published by Castro Calvo and colleagues, I was involved in this as well, has documented the validity of these 4 central features of ICD-11 gaming disorder. We recognize a wide range of problems which occur in people, including many young people who have gaming disorder. Some of these problems can stem from the sheer length of time that people play. I've said that there seems to be a threshold of around 3 to 4 hours a day, but people with gaming disorder may play regularly 12 to 14 hours per day. And indeed, such is the impact of the addiction that people have been described as playing continuously for 3 days, 4 days, 72 or 96 hours without stop at a gaming console or in front of their laptop or smartphone. Some of the problems include absences from school and college, leaving school and college prematurely, a decline in academic performance and achievement, day-night reversal. This is particularly likely to occur when people in, say, Europe or Asia or my part of the world, Australia, play in international groups with people who are in North America or South America. And so people in our parts of the world may play all night. There is recognized episodes of violence when the technology is confiscated, which some people consider to be a withdrawal phenomenon. There are physical health problems as well, low bone density due to little sun exposure because people are indoors, typically in their bedroom all the time, low muscle strength, being underweight because of lack of food, or overweight due to consumption of high-calorie soft drinks, dehydration because of failure of maintenance of fluid intake, and kidney or renal failure. And most importantly and most dramatically, the development of thrombosis in the legs and pelvis, and the dislodgement of those thrombi to form emboli, which can lodge in the heart and the lungs and cause sudden death. The very first person in the world who was described in the scientific literature as dying due to gaming disorder was a 19-year-old young man, originally from India, who migrated into the United Kingdom, and he died at the age of 19 due to a massive thromboembolism and cardiac arrest. What a loss of a young life. I'm now going to move on to talk about the prevention of risky gaming and gaming disorder, with a particular focus on the things that we should be doing in the COVID-19 pandemic. These are listed and developed as consensus guidelines by an international expert group headed by Ossi Karai from Budapest, and it was published in the Journal of Behavioural Addictions last year. There are a list of general preventative measures, making sure that in the restrictions and lockdowns as part of the COVID-19 protection mechanisms, that people, particularly young people and also old people, are engaging in regular physical activity, that they are sleeping regularly, and they're attending to personal food needs and hygienic needs. There are also specific preventive measures recommended, being conscious of screen time and regulating that, reducing access to electronic devices and putting them in places where it's not readily accessible, developing what I call rules of the home, so that parents can monitor and regulate children's access to electronic devices, involving the children in making the rules of the home. And it is essential that parents, both the mother and the father and any grandparents around, should regulate their own online gaming. So it is important to do what you say to your children as parents. Having pre-scheduled technology-free periods is useful, and there are some ways of setting specific limits on time for online games and other screen-based activities. Some countries, I think notably China, regulate the online gaming very considerably, and there will be an automatic switch off of online gaming after 4 hours of continuous gaming in an effort to prevent the development of gaming addiction. But that very rigorous approach is generally not in place elsewhere, and there are issues as to whether that is appropriate for governmental action. I'm now going to move on to talk about treatment and then service delivery. And whether you are working as clinicians, treating individual patients and clients, or whether you are service managers, there are a number of considerations to think of and a number of treatments available. First of all, it is important to think of the therapeutic goals for gaming disorder. Unlike alcohol and drug dependence, where very often the optimal goal is abstinence from a substance, sometimes this differs. For example, opioid agonist treatment is a largely appropriate goal for people who become dependent on prescribed or illicit opioid drugs. But whereas the goal for alcohol and drug dependence is typically abstinence from a substance, this cannot apply to internet access. It is not realistic to stop internet use. It is such a universal activity, and it is so much needed for information gathering, school assignments, university studies, and numerous day-to-day tasks. And so what we need to do, as in the first bullet point, is to have some restriction on gaming activities and quarantining of online games from other sources of information accessed by the internet. Now, what are the treatment goals which currently apply in clinical practice? We're guided by two systematic reviews which are listed there. The treatment goal for gaming disorder has generally been reduced time spent gaming, reduction in the severity of symptoms of gaming disorder, but also through various approaches, reduction in depression symptoms and in anxiety symptoms. Note that cessation of gaming, i.e. abstinence from gaming, has rarely been a goal of treatment. Treatment needs vary widely. This is a recently published study from Park and colleagues, and this was a survey of people who were concerned about their gaming and contacted a website offering help about gaming and gaming problems. And so what emerges from this survey was that people, predominantly young people who are concerned about their gaming, want to learn how to limit or reduce their gaming through the development of appropriate skills. Many were looking for treatment for comorbid mental health conditions, including substance use disorders and also depression and anxiety. Some were predominantly concerned about stress management, sleep disturbance, day-night reversal, for example, the development of social skills, some recognizing that they were rather deficient in that regard, and helping them develop skills simply in time management. Now, in terms of the various forms of treatment for gaming disorder, I quote from one of these systematic reviews. There were 22 controlled trials of treatment which were examined, including cognitive behavioral therapy, CBT, other psychosocial interventions, and also medications. Only half or less than half were randomized controlled trials. The main findings were that of 4 randomized controlled trials of CBT, 2 showed an effect of treatment and 2 showed no effect, as judged by time spent gaming. Of the trials of other psychosocial interventions, only 1 had a proper scientific design, and that, in fact, showed, unfortunately, no effect. Of the medication trials, 2 were randomized. One two trials examined bupropion, which is atypical antidepressant, and treatment with bupropion, interestingly, showed benefits in both trials. And escitalopram, which is a selective serotonin reuptake inhibitor, or SSRI, showed benefit in one of these trials, as judged by reduced time gaming, but also benefits in reducing depression and anxiety. Now, it seems rather curious that we're talking about medications as treatments for gaming, but those are the data that were presented in the systematic review last year. There are many innovations which are being examined, being trialed, and some just recently being reported. There is an intensive form of CBT, which is cited there, but that involved a very intensive session, 15 weekly group sessions. The development of CBT based on hot links to online games, which can be triggered after the person has been engaged in gaming for a certain length of time. There are various interventions which are often favoured by parents or guardians, such as residential camps, which are not scientifically assessed. Now, finally, why do gamers seek treatment? There are many different reasons to seek advice, but overall, those people who sought advice from the website that I indicated was studied by Park and colleagues, found that the adverse consequences of gaming had started to outweigh the enjoyable aspects. What were gamers looking like? This is particularly important for those of you who are service managers. Gamers were seeking online or telephone advice in particular. Online treatment was especially attractive because of its convenience, time efficiency, and it allowed participants to type responses with the therapist instead of talking, which was preferable, particularly for people who were rather introverted. There was a call in the last bullet point for different forms of treatment to help people with gaming disorders. Not only online advice, but less commonly face-to-face consultations for people who had very significant problems, particularly gaming disorder or the addiction, other individual approaches, group programs, and self-support programs. In relation to face-to-face physical treatment services, participants thought they should be in a convenient physical location, made suggestions for co-location with the university or other healthcare services, and co-located with services that address substance use problems, particularly alcohol and cannabis. There was also a desire for immediately responsive services available 24 hours per day, such as telephone lines or online intervention websites. So essentially, there needs to be a fit between client need and the content, quality, and the delivery modality of treatment. Finally, ensuring that gaming disorders not become an epidemic because of the impact of the COVID-19 epidemic also depends on our ingenuity to contain the pandemic. This will be achieved through ongoing care with personal behaviours, as I've mentioned before, personal protective measures, safer environments, vaccination against acquiring the virus and protection against the illness, and further development of effective treatments for COVID-19. Identifying risky gaming before it develops into the addiction that is gaming disorder is a priority of health services. We should importantly listen to what gamers would like in the form of early interventions and the forms of treatment and support that they would like. And I know some of this work is being undertaken in Turkey and in many countries in Asia at the moment. I think the older generation need to get wise about gaming. They need to be able to understand the thrill that so many young people get from engaging in gaming. And treatment research needs to be refocused on a broader range of interventions, including within-game interventions, as well as some more intensive ones for those with gaming disorder and comorbid mental health and social problems. And on that note, and wishing also that I was in Istanbul at present, I say thank you very much for listening, and I hope it has been useful. If there is any time for questions, I'd be happy to answer them. Thank you.
Mr. Sanders, we thank you for this amazing speech and presentation. Now we have Q&A session. As you may know, we have just 5 minutes for the Q&A section, so I need briefly answer, please. Okay. Our first question is which kind of connection appear between social anxiety and gaming disorder, sir?
So, sorry, I didn't quite hear that. What is the connection between?
Okay, I'm going to repeat. Which kind of connection appear between social anxiety and gaming disorder? Social anxiety and gaming disorder.
Yes. One of the issues about social anxiety disorder is that the person has a perception that they are being negatively viewed by other people. And therefore, normal friendships and personal relationships are difficult for them. Many people, in response to that anxiety in social situations and relationships, choose to consume alcohol or to smoke cannabis. And an increasing number of people are preferring to engage in online gaming, where the involvement with other people is entirely through the internet. And so they avoid having to meet people, and they avoid that sense of being judged by other people. And so social anxiety disorder is a recognized risk factor for the development of gaming disorder.
Okay, thank you. My second question is, let me find it. So sorry. Okay, my second question is, a client with gambling addiction indicated that he is having same excitement while playing online games. At the moment, he is not gambling. However, does the excitement, pleasure he's having while playing online games poses any risks?
Yes. A prior experience with any form of addictive condition, be it substance use or gambling, is a risk factor for the development of gaming disorder. One of the particular issues with gambling, of course, is the sheer amount of money which can be lost. One of my patients lost $20 million through a gambling addiction. And interestingly, he had several appointments to see me, but he never did take up any of those appointments because he was too busy gambling. And so some people can make the transition from gambling disorder to gaming disorder, and that will reduce the risks of losing such an amount of money. However, a lot of online games are being monetized. People, some of the games have introduced a gambling component. And so somebody who has a gambling disorder may engage in online games and still, in effect, be gambling.
Yeah, I totally understand that. Our last question is, during the pandemic, especially kids and young people started to use electronic devices more than before. How can this situation change? Do you think this situation change after the pandemic?
Look, I think
Hard, right?
I think we are in one of those phases in history where a new powerful technology has developed, which is incredibly attractive. Highly intelligent people are being recruited to work in the gaming industry. And these are very, very powerful motivators. I think the increase in gaming that we have seen, particularly in the period of the COVID-19 pandemic, will continue. There may be a decline to some extent, but I think there is a considerable risk over the next 10 or 20 years of gaming disorder becoming an increasingly prevalent addiction. And so, as a society, we need to think of what regulation should apply to gaming, and clever techniques such as within game interventions, including within game switch off mechanisms, which can prevent people who may be developing a gaming disorder to hit the pause button and to stop that gaming disorder developing. But it's a challenge for all of us around the world.
Yes, of course. We're going to try it. Thank you, Mr. Sanders. It was an honor to hear your presentation, amazing presentation here. Thank you so much.
Okay, that's a pleasure. Okay.
Have a good one, sir.
Thank you.
We would like to thank Professor John B. Sanders for his valuable speech and answer. After a 15-minute break, our second speaker, Professor Joel Billigs, will be with us with his presentation titled Conceptualizing and Diagnosing Gaming Disorder Without Pathologizing Healthy Gaming. Now we have a break until 11:15.